The human papillomavirus, or HPV, is a sexually transmitted disease that could lead to various cancers. 5 years ago, the HPV vaccine Gardasil 9 was approved for use in men and women ages 9 through 26. Now the FDA has extended the vaccine to be given to those up to the age of 45. Dr. Trung Nguyen is the director of gynecologic oncology at UCSF Fresno. He explains how common it is to contract the human papillomavirus.
It's quite common. In fact, the estimated that about half of sexually active Americans will carry HPV.
In fact, Dr. Nguyen says if you've ever been sexually active, you've likely been exposed to HPV. It's a virus with various strains. Some strains are more difficult for the immune system to fight off, and HPV can lead to certain cancers.
Cervical cancer, which is the most common HPV-related cancer, followed by vaginal cancer, vulva cancer. The anogenital area also affected by HPV.
There is a vaccine, however, to prevent certain strains of HPV. Gardasil 9 has been available in the United States since 2014 and was given to patients aged 9 through 26 years old.
The vaccine can reduce the rate of infections, reduce the, specifically for cervical cancer of women, that decrease significantly the rate of precancerous disease, which ultimately could lead to cancer.
But the guidelines have now changed. In October of 2018, the FDA approved a supplemental application for Gardasil 9, expanding the approved use of the vaccine to men and women aged 27 to 45. Dr. Nguyen shares what he has heard from many patients.
I am 27 or 28, and I feel like this vaccine can benefit me. I feel like I am a little bit low risk, and I think that I could potentially benefit from this vaccine.
According to the Centers for Disease Control and Prevention, about 14 million Americans become infected with HPV every year. Dr. Nguyen says he hopes everyone gets vaccinated to bring the HPV cases down, which he believes will also lower the cervical cancer rates in the country. He recommends children get vaccinated as early as 11 or 12 years old.
It is very important to get the vaccine at the age before sexual encounter occur. That will give us the best protections.